A frequent inquiry that numerous clients pose is, "Doctor, what exactly is the procedure of addiction treatment like at your esteemed center?" My dear friends, addiction in this day and age is not what it once was. The character of addiction within our nation and even globally has evolved. Addiction to synthetic substances, psychoactive drugs, methamphetamine, cocaine, and particularly dependency on stimulants presents a novel challenge. To effectively tackle these issues, we must employ contemporary tools. We are up to date with the world. Many of the substances that were used in the past mostly created physical type NC or physical dependency, and with comprehensive detoxification and a seasoned psychotherapist, we could largely address the underlying issues. Unfortunately, it is not like that anymore. Addiction to synthetic substances such as psychedelic mushrooms, crystal methamphetamine, and cocaine has resulted in severe psychological disorders and even psychosis in the patient. Therefore, the management of an addiction patient can significantly determine the course of treatment. Therefore, when an individual visits the clinic, a comprehensive medical history and a detailed post-medical story are initially taken. Co-occurring medical and psychiatric conditions, including bipolar disorder, anxiety disorders, ADHD, and other disorders that possess the potential to lead these conditions towards addiction, are thoroughly assessed. The patient's familial circumstances, employment status, and social standing are also meticulously evaluated. Based on the patient's particular condition, we prescribe a comprehensive treatment plan for them. It can indeed be quite useful, signifying that the prescribed treatment for the same individual might undergo changes. In one person, particular interventions can prove to be beneficial, whereas in another individual, those very same interventions might even be detrimental. Consequently, the manner in which the case monitor is chosen and how interventions are implemented are crucial aspects that a doctor and a specialist must undoubtedly pay close attention to. Certainly, the specialist is required to devote considerable attention to it, alongside acquiring a comprehensive medical history of the patient. We must have a variety of paraclinical tools for both diagnostic purposes and treatment. Presently, the utilization of QG as a diagnostic methodology on an international scale has resolved numerous issues, enabling us to determine our future trajectory and roadmap with a precise diagnosis. In accordance with the specific needs of the patients, we additionally carry out a variety of paraclinical interventions tailored for them. The utilization of RT has gained widespread popularity on a global scale and serves as a brief yet effective shortcut and a scientifically validated method through which we can attain optimal results in the most minimal amount of time. You see, for a patient who approaches us, we also take into account a protective measure or a golden period for them. We take this into consideration for the patient. Numerous institutions, various clinics and organizations like NA or numerous camps whose work is indeed valuable, and we have no intention whatsoever of questioning their efforts, but at this moment, time is of the utmost importance. We must deliver the maximum possible services to the patient during what is commonly referred to as the golden period, and numerous patients, if their time becomes extended, may indeed suffer. When the time for quitting becomes prolonged, patients might become discouraged and refuse to cooperate, or they might not provide the necessary cooperation. Therefore, one of our plans and work policies is to perform interventions in the shortest possible time for the individual. Alongside performing interventions, preventing relapse is as important to us as the treatment itself. In our country, for many illnesses, not just addiction, the value and credit given to treatment cessation might not be equally given to preventing relapse. The recognition and significance attributed to the treatment of the illness might not necessarily extend to the prevention of relapse, and we take pride in the patient who was successfully discharged from our facility. For prolonged durations, it is essential that we maintain consistent follow-up, and the center's professional psychologists routinely reach out to the patient. The patient is obligated to attend the clinic at regular intervals, and periodic brain mapping procedures are conducted. We meticulously design routine checkups for the patient to ensure we are fully confident that they have attained complete recovery. Consequently, we are dedicated to the follow-up and comprehensive monitoring of the patient. One of the methods currently used worldwide is the implantation of capsules. For 15 years now, incorrect capsules have become prevalent in the world, and the Hadi Sufi capsule has become popular in Iran. In advanced medical centers worldwide, it is being implemented, and we, as the pioneering and sole center in the nation, utilize these two methodologies to avert recurrence. Consequently, assembling all this clinical and paraclinical expertise, along with all these facilities and specialized medical professionals in this domain, is a commitment that our center has undertaken. We have successfully consolidated all the essential tools in one location to ensure that we can deliver the finest service to our esteemed compatriots.